All right, you guys. So my name is Jennifer. I'm the membership chair of the BHN Executive Committee, or the DPG, I guess I should say. And Jessica here is our policy and advocacy leader. I think we're the only ones that have managed to come on. Y'all, before I started the recording, I did mention that a lot of the people that were set to join us actually have been sick and emailed me, like, just so sad that they haven't been able to join. Oh, Kendall's going to join as well here. So just so y'all have an idea, we were hoping to have a lot of perspectives, but we want this to really be an opportunity for us to kind of describe what we did at FNCE. If y'all were there, I would love to hear any feedback at any of our events or anything like that. Also see if y'all have any ideas that we could do. Obviously, we can't do every idea that comes our way, but just see if there's anything that y'all want to expand on our presence in FNCE and that kind of thing. So Jessica, do you mind? Do you have anything in particular, anything that you wanted to highlight that went really well, or that you were, as far as within our events, and we can talk about FNCE overall as well, but as far as our presence there?
Yeah, I think there was quite a bit that went well this year, especially comparatively. The last year that I went was last year. So comparatively to last year, our BHN dinner sold out this year, which was very exciting. That was something that we struggled a little bit with last year, is like
Struggled
getting.
a lot last year, and this year we actually had a waiting list, so we were so sad we were able to accommodate a few more people than we originally planned for, but that was super encouraging to see the interest from our members for sure.
Yeah, absolutely. So I think that was great. The BHN show, or the DPG showcase, was wonderful. We had a lot of traction at the BHN booth, and I don't know what those membership numbers looked like, but I know that there was definitely quite a few people. The Academy offered that you could sign up for DPGs on site that day, and I know there was quite a few people who signed up there kind of day of after speaking with us. So I think that was also another really big success of some of the fancy events.
Yeah, I think we had an interesting booth this year compared to last year too. The fidgets, I know, got people over there. We had some advocacy stickers and things like that as well. So I think there's a lot more to engage with compared to what we did last year.
Definitely.
Well, what about in particular? Sorry, if I look distracted, it's because I'm admitting people into the waiting room as they come in. What about in the dinner as well? Like, I feel like I liked the format a lot better, I feel like, than doing the panel that we tried to do last year. Do you agree with that?
Yeah, I think that it definitely allowed folks to be more conversational at their tables, which I think is such a benefit of those sort of events, the networking, getting to meet people that you don't work with. So I agree that I think that the way that we ran it, of having that video that kind of sparked conversation, and then also allowing like open dialogue between the members who joined, was a great shift.
Yeah, and actually it just occurred to me when you mentioned that video that we had talked about, so at our FNCE dinner, it was like a 15-minute video where the different resource professionals talked about a time in their career where they were advocating for their patient. And we actually talked about putting that on YouTube so everybody that wasn't at the dinner could see that. So I need to reach out to whoever has the recording and can get that on YouTube so everybody can watch that for sure. But yeah, I thought that was really well done. We obviously had a hiccup where some of the bio information got mixed up on our award winners, but we definitely have already taken that as a learning experience and have it will be corrected so it doesn't happen again next time for sure. So do you have anything to add to that, or does anybody, y'all feel free if you want to jump in and unmute, or if you want to shoot me a message. If anybody was there, let me know, and if y'all have any thoughts or inputs on what you would like to see at a dinner like this. Did you like having it split up the tables among the different like branches of BHN? So like the people that work in addictions together, the eating disorders, did that work well for you?
I think so. I think it's helpful, I guess, to like talk with folks that are in your own field as far as like networking goes, but I also don't feel like it segregated anyone. So it was like only these people are allowed to interact and only these people, right? So I feel like the way that we kind of sandwiched networking events generally for the whole room, with people sitting kind of in their individual cohorts, was really helpful.
Yeah, I think so too. So I sat with the mental health coworker, members, and they had a lot to say, a lot of different experiences. Even, I mean, mental health is kind of a broad niche, I guess you can say, but everybody worked in a different setting. So it's definitely very interesting, just hearing everybody's stories and where they are in the learning process and stuff like that. The lady that was sitting next to me, she was the person that nominated one of our winners. And they had just opened up a behavioral health unit in the hospital that she works at. So she was just brand new, learning all of that along with the person that she had nominated. So lots of conversations that were had there. So I thought it was really interesting. So cool. What about the student event?
That one I think was a little bit tougher. We had it at 8 a.m., which I'm sure for most people is hard, but especially for
It
students,
was
it's
hard
hard.
for
Yeah.
me to be there.
Yeah.
At 8 o'clock,
So I
yeah.
think that was probably our biggest barrier to attendance was how early the event happened.
Yeah. And we kind of knew going in that that was going to be a problem. Unfortunately, we don't get to plan these things for whenever the heck we want. We were kind of given a time slot for it. We tried to avoid last year. It was the day before, right? The opening session, right? And nobody was in Orlando yet. So we were trying to avoid that, but this ended up being like the last day at 8 o'clock. And I'm sure everybody was just tired. So the students that came were wonderful. They had a lot of questions and interacted really well, but there wasn't as many as we'd hoped, I thought, right? So
Yeah.
unfortunately, I don't know that there is a perfect way to fix that because it's kind of you get what time slot you get, you know. But yeah, I think I liked the idea. We had similarly, we had the resources professionals kind of split up so the students can talk to who they were interested in. Having such a small turnout, they got a lot of attention and a lot of interactions and stuff, which was, good for those that showed up for sure. So. I did have an interesting experience outside of BHN. They had a speed networking event for the students. It was a lot of fun. It was at a much better time period. So it was packed out, but that was a super interesting way to do it. I always felt like I didn't have enough time with each group of students or whatever, but they got to talk to a whole bunch of different people and different experiences. So I don't know if that's ever something that we could even organize on our end, but it was an interesting concept. I hadn't done anything like that before. So. Well, what about, do you have anything else to add about our own events?
I don't think so. I think we kind of covered the three that we had.
Yeah. So anybody here, do y'all have any thoughts to add? Have y'all attended FNCE either this year or in the past? Anything that worked well or that you don't want to see happen? No? Okay. So what about Jessica, were there any sessions that you attended that you thought were really, really good? Or opposite, if there's something that you felt was bad, we can talk about that too.
Yeah, there were a couple really good ones. One was Tammy Beasley, and I cannot remember the name of the therapist that presented with her. I can look it up, but they talked about trauma and kind of working from a somatic lens and addressing trauma and eating disorder care. So that was really a wonderful talk. And
Got the one on polyvagal theory?
yeah,
Yeah, I
yeah,
didn't know you were there. That
yeah,
was a really good talk.
it was, yeah.
Our chair, y'all, Sean, he was the moderator for that
The
session.
moderator for it. Yeah. So it was a really great one. I also attended one about the male and female athlete triad, which was also very interesting and educational. So yeah, I think those were probably the two, I don't know, talks that I would highlight this year that I felt like I learned a lot from.
Yeah, I feel like the polyvagal theory one was really, really good. Really appreciated that talk and having the therapist involved. And said Katie Cox, I don't know how often y'all attend or look at the YouTube videos. Our eating disorder resource professional and I say recently, within the last 4 or 5 months or something like that, did one of our office hours on polyvagal theory, which is obviously very short and doesn't get into the the nitty gritty, but the way they interacted I thought was really good. And yeah, that was a really good session. There were so many that I wanted to see that we either had to get ready for an event, so I didn't get to see, or there's a couple on the gut microbiome that I didn't end up getting to see. But yeah, there are lots of different ones. I felt like, and I don't know if this is just my perception or if you noticed it too, that there was a lot more for behavioral health as far as sessions go than I noticed last year. Do you think so? Or
I would agree. I think there was also a big shift in sort of I don't know, being more careful of including inclusive care talks. There's a lot of different panels and discussions. Like one of them I went to was bridging the gap between eating disorder and like bariatric care essentially. And that one was really interesting to be
That
able
was
to
one of the ones
see.
that I really
Yeah.
wanted to see and I didn't get to go to it. Yeah.
Yeah, there was a really good conversation between the professionals that kind of sat on both of those sides. And I think those are always productive conversations, even if they're kind of uncomfortable, I'm sure, for the presenters, but I think they did a really wonderful job. Another one that I saw actually that wasn't eating disorder related, but it discussed the use of psychedelics, how they're starting to have a lot of clinical trials on those specifically for folks who have had severe complex PTSD, and talking about that in the veteran community. And that was a really, really interesting talk, kind of like what the dietitian's role is in that area.
Yeah, that conversation is really interesting. Actually, I don't know how many of y'all are podcasters. Uh-oh, somebody's trying to log into the Zoom account. I don't want to, sorry. I don't want to accept it and then accidentally like knock us out of here. So I don't know if that's somebody on the EC that's trying to log in or not, but maybe they'll message me if they're trying to. Sorry, podcasting. I don't know if y'all are aware of Maya Bialik's podcast. What is it called? Maya Bialik's Breakdown. She had an episode kind of early on in that podcast series that discussed that. It was really interesting as well. So hearing from different perspectives is definitely helpful.
In the chat?
Say that again?
Could you put that in the chat?
Yeah. Well, the podcast is, maybe if I could type.
I also included the link to their starting clinical trials for MDMA assisted therapy for eating disorders. So I put in the chat kind of like, I don't know, their little breakdown of that if anybody's interested in looking into that.
Awesome. Let me, well, y'all don't need to watch me search for it. If I go back and find the episode, I can always drop it in the discussion board as well with the actual episode and maybe the link there. So if y'all want to listen to that, but it was definitely super interesting. And for those of y'all that are in eating disorders, Maya Bialik has started to talk a little bit more openly about her eating disorder. And especially how she struggled with it while they were filming The Big Bang. It's not a huge focus of it, so it's not like go to this episode and you'll hear it, but she talks about it in an interesting way, and I think a little bit different than how like we talk about it. As just somebody, I mean, she is very science-minded, but she's just not in the field, and it's an interesting listening to her and her personal experiences for sure too. So and obviously she has a lot of pressure about, you know, body shape and, you know, different things like that as well. Yeah. So what about, oh, actually you mentioned talking about inclusivity, inclusivity and stuff like that. And that is definitely something as a DPG, we've been really trying to advocate for and be involved with and stuff like that. And at our dinner, a gentleman kind of put it fairly bluntly that he feels like not us specifically. I didn't feel like he was targeting us in that statement, but he feels like a lot of it is performative. And something else was going on at the same time of our dinner that like really highlighted his point. Do y'all have any thoughts or experiences with that within FNCE or the Academy? How we could be better about not appearing that way?
Could you go into more detail what you meant? I wasn't able to attend that.
Yeah, so essentially what we were doing at the dinner was we had conversations about advocating for our patients and, you know, different things like that at our table. And we had one person at each table that was going to speak and kind of summarize what we had talked about at our table and stuff like that. And they were all really good conversations, lots of stuff, and they got a prize for speaking out. And the last table was, they were the addictions one, right, Jessica?
I think so.
I think it was the addictions table. There was a gentleman there in a wheelchair, and he is a Black individual. And he basically said, like, I keep hearing about all of this, how the Academy is standing for inclusion, and we really want to diversify, you know, the field and stuff like that. And he felt that it was a lot of talk, but maybe not a lot of action that he wanted to see. And as kind of an aside, I left the room to go to the bathroom, and it was a little bit of a walk, and I passed the diversity committee, and it was all white people sitting at the table. So like, it was just an interesting way to like, I mean, not that I don't want to say I didn't believe him, and I don't mean that at all, but just like for that, to see that like right after he said that, you know, was very like, yeah, he's right. So hopefully if, you know, through everything that we are doing, we don't sound like that. Hopefully we're trying to, we're really hard to actually like donate. All of our donations and stuff tend to go towards diversity measures and stuff like that. And then also actually next month, I just spoke with the our IDEA liaison, and she will be hosting office hours next month on this exact topic. What did you have a takeaway? Did you have a thought? Anything on that?
Me?
Yeah.
Who are you- Oh, yeah, I think that, I mean, I agree. I think that historically there's been a lot of struggle within the academy for inclusion. And I see that obviously like there's effort to make changes. It was very clear in the keynote speeches as well, like from the academy president and CEO, that they really are committed to making changes. I guess we just have to wait and see if it is performative or if it's really actually there's going to be something to come of it. So I don't know. I mean, it was great to hear at FNCE, but again, I think there has to be like action behind those promises.
Sure. Yeah. So Kirsten, did that explain what the comment was, or did you have more questions about that?
Yeah, I wasn't quite sure what you meant by performative, but now I get it. So
Kind of just talk
kind of trying to say talk without action.
Mhm.
Yeah.
Yeah.
I'd love to see that too, because kind of my experience there, I'm in the behavioral health, but I'm in more of the special needs and rather than the mental health, but there's certainly crossover.
Oh, absolutely.
Yeah, mental health and eating disorder, and yeah, there's certainly crossover, particularly as it comes to like food avoidance, because I'm also working with I'm looking to work with, I'm actually just finishing up my internship with people with like multiple food allergies and food sensitivities and things, because it's quite natural, unfortunately, to develop a fear of new foods.
Yeah, sure. Yeah. And I think last year, the big takeaway we took last year was that the IDD members felt like there wasn't as much support within BHN. So we've been trying really hard to make that branch of our DPG louder and, you know, do that. But that being said, to kind of tie that in with the diversity, not all of us, a good chunk of the executive committees recently took a training, and that's what's going to be presented next month. And that was one of the shortfalls, I guess is the best word to say, was that they did not discuss disability as much as they probably should have in that. So that's
Aren't they opening a new DPG on disability?
So there's a MIG, there's a
MIG, yeah, member interest group. Okay.
Yes.
And I think the MIG is more so for dietitians who are part of the disability community, more so than dietitians who serve that community.
Yeah.
Yeah.
Well, can't we be both?
Yeah,
absolutely. Yeah. And actually a really good Alicia, we're gonna forget her name now. Shoot.
The one that spoke last year.
Yeah, she spoke last year, and she was there again this year presenting a poster based on some of the MIG, and she had a lot of information on it was mostly give me a second.
Sorry, I wasn't able to go between internship and kids.
No, understandable. Her name is Alicia. I will find her last name here in just a second. She has a private practice, and she does a lot that is involved in making like cooking really accessible. So she has either just really easy, or, you know, here's this fancy recipe. You don't need that. Like she particularly mentioned like wine, like if you're only buying wine to cook this recipe, like here's other options. So you don't have to, you know, stuff like that. And to
it's really Alicia Connor.
I almost said cook, and I was like, I know that's not right. There you go. So she's a really big advocate in that area. Like I said, her poster was part of the MIG, and it was based on kind of how to make sure your websites are accessible. So talking about like contrast and using the alt text correctly, and actually stuff on there that it had never even occurred to me. So that's definitely something I took a picture of so I can make sure I'm doing that stuff right. So yeah, that it's definitely, they're getting out there as far as the disability goes. But yeah, I think that their mission, so to speak, is just a little different. So you could definitely get benefit from being a member of both and getting different resources and stuff for sure.
Awesome. Yeah. Because to kind of comment to what kind of prompted me to start discussing with you, it's when they say, you know, a lot of talk, but not action, not enough action, it's kind of, and I can't speak for the those with race and ethnicity, that's, you know, visible issues that it's like as you start to pull something out, there's like these little roots and tendrils that people didn't know that are there, that kind of get left behind, and you kind of have to take the time to pull out. It's they're hacking at the to use an analogy, we're kind of hacking at the stem, but it's still going to take time to dig the roots out. And that's in ideology, that's in, oh, I didn't realize that was a barrier to you, and different things like that. It's as a woman with ADHD, with kids with intellectual disabilities and food sensitivity and eating issues and whatnot, it's what is it, having, just trying to I'm trying to be the representation I wish I'd had. And at the same time, I noticed in like my grad program, it's like they had like these prescribed ways they would help me, but when I asked for additional help, it was inconvenient, but all right. And then it hit COVID, and they're like, no, I don't have any time for that. When I'm literally going the crossover of COVID and my kids being out of school for a week whenever they have a cold, and trying to do this program, and my intellectual differences means I need more help now,
Right.
not less.
Oh, for sure.
And
I think that's an issue kind of, I mean,
the cross-sectionalism, it's like this gentleman you were mentioning, he's physically disabled and he's Black. And so when he asks for additional help, they're like, well, we can't give you more help than we give someone who's in a wheelchair. Or, well, we don't need to do that kind of help for somebody who's Black. He's like, but I'm both.
Yeah. And I think that has to do with a big talking point that we mention a lot, is like equity versus equality of care. Because yeah, absolutely, no two people are going to need the exact same thing. And I even tell you, even just in my private practice, just yesterday, spent almost an entire session trying to talk to somebody about, let's figure out, like, we need to get her out of her oh, what do they call it? It's been so long since I've done that part of college, but she was in the whatever the physical activity requirement is, and like she's not appropriate. Okay. She needs to get out of it. And just trying to find the resources and the accommodations that she needs to not be forced to be doing like intense physical activity with a group of people right now. She's just convinced there's no help for her. So like, how are we going to navigate this? Who do we need to talk to? And it is either intentionally, I don't think intentionally, but I don't think that the people that are working within that are being intentional and saying, hey, come get this, because she felt very much that like she was going to be causing a problem if she asked for those accommodations. And I don't think that there's enough to be done. There is enough done to like project that, like, no, that, you know, you need to reach out for these resources. That's how they become visible. That's how more people can get those accommodations and stuff. And unfortunately, it's a lot of self-advocacy right now, and it shouldn't be, right?
And that's a physical and emotional and mental burden. Like, I had a professor tell me that unless it's written on your accommodations, I'm not doing it because I am kind of stressed to my limit right now. And so I had to go through the process of getting it written into my accommodations, and just so that she would follow it.
Even with that, and right there with you on the ADHD, just have an executive function to initiate that, and then stick with it, and remember to answer the emails, and remember to, you know, all of that. It is a lot of work, a lot more work, I feel like, than a lot of people like, we'll just go do it, just send the email. But be really hard. So yeah, hopefully, as we drag
You
along.
don't know how valuable executive function is until you don't have it.
Yeah. So learning a lot about it since I was diagnosed fairly recently it's explained a lot about myself for sure. So I was not diagnosed until after I was done with school. So, I didn't get anything, but
Yeah.
yeah.
Another example of that one is having a professor who, what is it, just after I got a car accident and I asked for those additional helps, she was perfectly willing to help me. But 8 months later, when I had the same issue come up in a class, she's like, well, you should be able to do this. I'm like, says who? I explained to you my ADHD and my thing. And oh, maybe I need to go tell my psychologist they're wrong.
Yeah.
It's like she didn't get it, that I wasn't asking for that accommodation back then because of just my physical problem I was doing. It was because of the ADHD with the physical problem I was having. And it didn't click. So
yeah. So I think that, like, not to argue his point, but like the talk has to be there before, like, to kind of drag the action along with it. I don't know if that's the best way to say it. In my head, that makes sense. I don't know if I'm verbalizing it very well, but the talk definitely still needs to be a part of it, but we need to make sure, and all that we're getting the motion in there too, I guess. I think that was the biggest takeaway that I took from his comment with that. So
keep working. Don't think that we've done just enough.
Yeah.
Because just because there's nothing visible above the ground anymore doesn't mean the roots aren't down there still causing issues and buckles in the pavement for people who are trying to get help.
Yeah, for sure. Does anybody else have anything to add to that? Or and also, not to just knock you off, Kirsten, you feel free to add what you need to, but does anybody else have?
I'm done with my soapbox.
No? Okay, let me see. I wrote a list of questions just to make sure that we talked about. Jessica, do you feel like, I know you mentioned that, sorry, like your big takeaways from the sessions that you really enjoyed. Did you feel like there was anything that you left that would be like actionable in how you practice? Oh. Jessica, are you frozen? No, I think she might be frozen. I'll tell you, I don't know if anybody else, like I said, was there, but I felt like I kind of like, oh, there's Jessica. Did you hear my question?
No, my internet went out.
Okay.
Sorry, what?
No, I was just asking, I know you talked about some of the sessions that you had attended and like kind of like, wisdom and stuff. Did you find anything that you felt was something that you could apply and change how you practice?
That's a good question. I feel like I probably did learn something in the polyvagal discussion that I just am blanking on in this moment of being able to like say off the top of my head. But I know that there were
You're right on the spot.
yeah, there's definitely pertinent things in there that I really took away from it, of just kind of like better understanding. They made this analogy of eating disorders kind of being like a riptide and not so much of like a flow in and out, but it kind of like pulls you in and kind of you feel stuck. And when you fight it in a certain way, it just makes it worse. And so having to like, do where you like relax and then it's easier for you to kind of get out of it. And so I found that really interesting, of like trying to help clients regulate in session so that we can actually do deeper work versus it being like, like fighting when that anxiety is so intensive, or like not much is going to come out of that.
Yeah, I liked their little sponge demonstration, and definitely just the thought of like walking people through like the grounding technique and stuff like that. I think that's going to be really helpful for sure. I have some like really short YouTube videos that I have just kind of bookmarked so we can like run through a breathing exercise when like it's getting too much, you know. But I like the idea, like, I don't know, I always default to like that's the therapist and I need help leading that. And I think I feel a little bit more I guess empowered to be able to kind of do some of that stuff without being like, hold on, let me find this resource for you real quick, you know. So I think that was really helpful. And then some of the businessy ones I tend to, I would go to a bunch of science ones and then my brain just couldn't handle science anymore. So I was like, let's do a podcasting session. That one sounds good. So every once in a while, like some of the science one, and honestly, like to go back to the ADHD thing, the sessions are an hour and a half long and I've got about an hour attention span. So that was kind of my difficulty there. But that session, I think I was pretty much engaged with almost the whole time. I was ready to start moving, but at least I could still like listen to them with that one. So, awesome. So it sounds like that was definitely, I think both of our favorites, it sounds like, was that polyvagal theory one.
Yeah, it definitely was a good one. I also attended one that I thought was very interesting that kind of talked about the female and male athlete triad and how different it is, like with the low energy availability for assigned female at birth versus assigned male at birth, and like what that really looks like. And that was very interesting to me. There wasn't a lot of discussion about like practical application, but it was at least interesting to know, like, okay, this is what low energy availability looks like for one sex versus the other.
Mm-hmm. Yeah, sure. Kristen, are you asking us to clarify?
No, it's
okay.
more of I'm writing these down so I can go look them up.
You should be able to find it like that, but just in case you have a problem.
They haven't put the 2023 ones up yet. I just looked.
No, it took a lot longer than I thought it would last year to get the recordings. I want to say it was like 2 or 3 weeks out. I didn't buy them this year because honestly, I bought them last year and I haven't watched a single one. So I didn't spend the money on it this year. But yeah, it'll pop up if you're interested in doing that. But the polyvagal is VAGAL. If you start Googling, just so you should be able to find it with that, but just in case.
I spelled it wrong.
Yeah, no, that's fine. Okay, so let's see. Honestly, I feel like we kind of just chatted about most of the questions that I'd written down, just kind of come up as we were talking. Let's see if there's anything that I wrote. I would love, Jessica, if you have more insight or topics about that crossover session with the obesity and the eating disorder practitioners. Because I definitely feel like they get pitted against each other so much that it's really hard to see that how much of an overlap and stuff like that. And I feel like, to me, if I'm talking to some of the practices within that realm, the biggest thing that I always try to take away is that the body image tends to get worse, especially after bariatric surgery, and everybody just kind of assumes it's going to get better. And I don't think that there's nearly enough discussion around that. With that, you know, the one therapy session that they're required to have for insurance is not in any way going to touch on that.
Right.
So curious if that came up or if there was anything that you felt like we could take away not being in that field, or what you made it sound like it was fairly productive, I guess is.
I don't know if it was just the provider who was there, but it sounded like she worked in a, I don't want to get it wrong. From what I remember, she did primarily weight loss as her, like, what she does. I don't know if she worked in a weight loss clinic or what it was, you know, main role was, but it sounded like, from what she said, a lot of the conversations that she had with clients were like, what are other things kind of we can do without like automatically seeking like bariatric surgery or weight loss medications, and that the focus wasn't really on weight loss, which is confusing to me, but I don't know, like maybe that's kind of how the field is shifting, which I thought was very interesting, that was kind of what was discussed. I think that Yeah, it was a very interesting discussion kind of presentation. I think the biggest thing that was a shock for me was that one of the presenters, and I don't really understand like what her role is generally, if she is on the eating disorder side or the weight loss side of that debate, but she didn't make it because she was in eating disorder treatment and she had a really severe eating disorder that developed after she got bariatric surgery. And so she had a statement that was sent that she had talked about kind of what her experience was. And I just thought that was so fascinating. I couldn't really get a clear answer from her website on like what she does for work. So I was like, I don't know if you like are pro bariatric surgery or not, but I guess that was just like an interesting turn of events that I think was very eye-opening of like, it really does increase the likelihood, I think, of like developing more severe eating disorders. So yeah, the conversation wasn't so much like them having a debate, but more so just like, this is what we do, and this is what we do, and this is how we can both kind of like be in this space and not hate each other.
Right, for sure. And honestly, like I have a past patient that in mind when you mentioned that her mother pushed her into having bariatric surgery because she decided that was what was going to cure her binge eating disorder. And like, surprise, it didn't. And it was
More risk for complications.
oh my gosh, so many issues. So this facility was a residential rehab, addiction rehab, and then we had a program that kind of helped support like concurrent eating disorders. So it wasn't eating disorder treatment strictly, but yeah, it was.
We'd recognize the crossover and we're treating it.
Yeah, it was a mess, obviously, and just the shock that I get. So I can't remember the last time I saw somebody that sought me out prior to bariatric surgery, but I see a lot of post bariatric surgery, and almost every single one of them. I say almost, I kind of mean every one of them, but I don't like absolutes, but almost every one of them has definitely been like, no, why is my body image so much worse? And they're just shocked by it. So it's definitely something that, if we're working towards communicating with the different types of practitioners, I feel like that needs to be spoken about a whole lot more. I don't know if any of y'all are familiar with the Maintenance Phase podcast. This is kind of tangentially, they just did a episode on Ozempic that was really interesting. Also, they're kind of funny, and I always probably more of a concept or a constructive how I was raised, but language warning if y'all don't like some cussing in there, that's not the one for you. But it was super interesting how they talked about it and all the research and stuff that they went through. And there was another thought, if any of y'all need help and support with learning about body image, there's a dietitian named Amanda Mittman. I don't know if y'all are familiar with her, but she reached out to Brie Campos, who is a big body image therapist, and trained under her. And now she works towards training dietitians to work with it too. I think it's MITTMAN. And I want to tell you it's like the bitchin' body image dietitian or something like that. It's something along those terms. You should be able to.
I might have heard of it then.
Yeah. So, that might be a resource if that, and she's not specifically talking about bariatric surgery anymore. It's just something that somebody said.
No,
of her.
but I found her because she covered a lot of bariatric surgery, and it's kind of interesting being in this process and having two family members go through bariatric surgery at the same time, because they felt like they tried everything else, literally. And one had PCOS, and now she's trying to, and has just gotten pregnant. So I was trying, basically, I found the Bitch and Body one because she in addition to that, she covers PCOS, post-bariatric, and fertility post-bariatric. And having found that, I was like, yay, I have somebody I can refer my sister-in-law to as a potential resource, because that is not my field of focus thus far. But I really want her to be supportive, and I would love, my niece or nephew to carry, determined, do everything beautifully. So
yeah. Let me verify that. Actually, I'll just pull her up on Instagram real quick and get y'all her.
Yeah, that is her, the Bitchin' Body Image RD.
Oh, did you find it? Okay.
Yeah.
Yeah. I found her randomly on Instagram and I was like, hallelujah, because I've been looking for resources for my sister-in-law. So
As I see that last name written there, I keep thinking like it doesn't look right still. But yeah, she's on there. I think she has so she has a private practice as well. So you should be able to find her either way through that. But she's really interesting. And then Brie Campos is a really good fellow too. She has a podcast as well that's all about body image and stuff. It's geared more towards individuals or patients rather than dietitians, but I think that both of those are super important. So
Yeah, I really like her approach to body image too. She talks about body grief, which I think is so empowering. And honestly, like so many of my clients resonate with that so much more than like neutrality or positivity or whatever else. But just this idea of like when your body changes as part of recovery or whatever, it is really hard to lose what you had before, especially in the society we live in. So like allowing space for grief to be part of that process.
awesome.
yeah.
Any
Sorry for the-
other
Yeah.
I don't know. Do you have anything
I
else?
absolutely love that about the body grief. And I now really want to go look that up because
Yeah.
some of the people, I think part of that reason, like, what is it? I was looking at the statistics about, what is it, bariatric surgery, that, what is it? They said the younger people got it, the more likely they were to be dissatisfied with their final body. It's like, it was exactly that. It's possibly they took it as all of my body image issues are going to go away once my body looks a certain way. And it's no, they don't. There's still that kind of root digging out of those same little roots that have to happen.
Yeah.
And what is it? It's so just like looking at the two of them going through that journey after their bariatric surgery of like, I look at my mom and I'm like, what happened to you? You're like shrunk, because she's been overweight since I've been a kid.
Yeah.
My mother's the other one. And it's like, at the same time, she's like, I've tried everything under the sun I can think of. My hormones are very resistant, but it hurts to chase your kids around.
Yeah. Yeah.
And
There's
so,
that topic I feel like you just hit on could be hours of conversation outside of like where we are now. There's so many pieces of that for sure. But yeah, I really like
quality of life versus wanting them to do it in a safer, more potentially healthy way. But who am I to judge when it's a quality of life issue?
So that maintenance phase podcast, I really liked how they put out, they were talking about like if, how did they put it? I don't want to get it wrong. Y'all can definitely go listen to it, but kind of like if you want to use Ozempic or, insert bariatric surgery or whatever here, that is, you have the autonomy to choose that, but also like you need to look at the whole picture. It's not going to fix everything. There's all these other pieces that kind of go into it, and it's not the miracle that it's presented to be. But yeah, I think that that autonomy, like you just said, like
right,
needs to be there as well. So
and properly trained practitioners, because what is it? I also have family background from rural areas. And so they carry a ton more muscle, which makes them look thicker than the average city white person. So on the BMI, they're being told they need to lose weight when they can go home and like, until I had that health issue, I could carry my kids around by their feet.
Yeah.
When they were like 80 pounds.
Yeah.
And it's like, so there is that you have to have somebody who knows what they're doing and is able to assess whether the overweight or the obesity or whatever is hurting them for their current stage of life and physical needs, or whether that could be held off in favor of like learning, loving their body and joyful movement and different things like that.
Sure. Yeah, I would encourage you to go onto our YouTube channel. So it's just I think it's BHN DPG. And so she's our past trainer now, Teresa. She did a really good presentation at one of our office hours for body image. And that's up there on that. You should be able to find it pretty easily. She did a really good kind of breakdown of like a lot of myths that people hear about, like, the different like haze movements and things like that. She did a really good job kind of breaking down all of the different pieces. Obviously, a 1 hour office hours isn't going to solve all of this, but that might be a good place to start thinking about it and looking at it and stuff. So, yeah. Does anybody else have any other thoughts? We kind of got off of FNCE a little bit there, but all of y'all that are still muted, do y'all have thoughts or questions or anything? Faye,
Yeah, I'm Faye. Yeah, no, I've just been taking it all in like a sponge. But the polyvagal theory, the REDS, male and female, and the body image after bariatric surgery, those are all going to be presentations we can view at some point.
so those were presentations, I don't think the body image.
Not the, that was
No,
just.
I think that was a subject within
Okay.
the
we kind of jumped
bariatric
onto, but
surgery
the
one.
other two
Yeah.
were sessions that we attended at FNCE. So if you bought the recordings, then yeah, those will be there.
Okay.
And I think I don't want to lie, but I think that you could probably still go buy those recordings. So
Are we allowed to share the slides, or is that illegal?
I don't know the answer to that.
I don't know the answer. Let me check on that, and then if we can always reach out.
Put them on the discussion board or something like that.
Yeah, or something. Yeah.
Jen, you had a question or a comment?
Yeah, I have a question. So I work inpatient, and my master's was in kinesiology. So I was I am starting to get into sports nutrition. And our sports medicine department, they're going to run a pilot and start including nutrition, which is great. One of the things that we were wanting to screen for was eating disorders, so that we didn't provide MNT, because I work for Kaiser, so they usually we're providing sports nutrition MNT is basically what I'm trying to say, so that we're not providing MNT for sport when there is an eating disorder component, and to send them to behavioral health or the psych department, and before they come to us. So I've posed this to the group, we have an eating disorder group that I attend, and so I'm not primarily an eating disorder dietitian, but I think there is a lot of overlap in terms of needing to be, that's why I'm joining this group now, and trying to be more aware of the difference between like disordered eating related to sport and then eating disorders. And I guess my real question is there a tool that you guys are aware of that's validated that I could have my physicians use, sports medicine, to screen patients so that they're not sending them to us? Or do you think that they should send everyone to us and then we should do that screening? What do you guys think?
Yeah, I can answer this question. I work in the eating disorder sport nutrition world. So there's a couple different options.
Okay.
Screen them ahead of time prior to coming to you. I think the most validated ED screening tool, and I can confirm and let you know, is the Eating Disorder Index, the EDI. So that might be one to utilize. There's also one called the DESA or DESA 6. It's Disordered Eating Screen for Athletes. So you can always do that once they get into your care in the sports nutrition department. If you suspect that there's disordered eating, that one is specifically for athletes. So I think it can kind of be either. You can kind of figure however you want to do it. If you want them to screen prior or once they're in your care, it might just be like 2 separate screens, depending on if you're seeing that there's disordered eating within these athletes and maybe it's not an eating disorder, if you want to screen for an active eating disorder prior to them coming to your care.
I'll say that I've used the EDI in the past and it's fantastic, but also it is a lot of work for them to fill out. So
it's very long.
It is. It's really good, but we were having a lot of issues with trying to get people screened at that residential facility, and it would take them, and granted, totally different setting than what y'all are talking about, but it would take almost like 2 or 3 weeks for some of them to get it back. And in the meantime, we're we need to get this moving. So it's a screening, but it's not like a quick 10-question screening, I guess. That would be the only.
Yeah, it definitely isn't. It might be one that you do like in a session or during an appointment, so you can kind of walk through it with them. That might be
Mhm.
helpful. Some people will do that, but I'll send the DESA 6 and the EDI. The DESA 6 is 6 questions, which is called why it's
Okay.
called 6. So that might be kind of a place to start. And then you can always do a more extensive screening, or even via like the DSM categories if you have therapists that work on your team.
Yeah, I don't think in sports medicine they don't have I mean, but it's an easy referral, right? So I just
Absolutely. Or
want to
even if
make
you have
sure,
like a
yeah.
sports psychiatrist or psychologist or anything.
Mhm.
But yeah, it is a pretty easy referral to get at least the diagnosis if you feel like it's important.
Mhm. Okay.
And there's going to be
Okay.
some that aren't going to show up, and that's, just kind of paying attention in sessions, and
Yeah.
you get
I do
surprises
really
sometimes.
like that they have one specifically for athletes, because again, with that, working with that, semi-rural population before, it's some of those red flags don't show up because their presentation's going to be different
Mhm. Definitely.
than your standard eating disorder, which, as we know, there isn't a standard. It's just there's averages.
Yeah, for sure. And definitely there's a big difference in presentation in male and female presenting people as well. So
Mhm.
um Tana, if I said your name wrong, I'm sorry. So office hours ideally is the third Thursday of every month. So this one we pushed back because we just all got back from FNCE and we wanted to give ourselves a little bit of a break and decompression time before we brought this to everybody. But in reality, everybody that is on the board and the resource professionals, we are all volunteers, and we have jobs and appointments and stuff like that. So it's kind of like a framework of that third Thursday at 2 p.m. Central. And then, if they're not available or we need to push it back or forward, or, different times and stuff like that. So I wish I had a better, like, hard and fast, like, time, but it's just not possible given the nature of the board. But we did, I don't know if y'all have seen the awesome new website. If you haven't seen it, like, go to it. I now have access to actually editing the event calendar. So I will, as soon as I know, I will add it to the event calendar. And then I always try to put it on the discussion board as well. And then we have, there was a problem with the email things getting sent out. That's why y'all all got the email like last night and today, is because we were like, what happened to the email? So we try really, really hard to communicate. But unfortunately, fighting technology and everything can happen. I will tell you tentatively the next one is going to be on the 16th, but I haven't fought that, put it right down. But yeah, as soon as I know for sure when it is, I try to get it out there, but it's just lots of variables that go into that.
Thank you.
Yeah.
And yes, you pronounce my name right. Yeah, it's Tana.
Awesome. Jessica, so we do have a newsletter. It goes out once a quarter. And I believe, did she say? She said it was coming out, but I don't remember. Did she say it was in December? Jessica, do you remember?
I don't remember.
It's coming, it's every quarter. I'm pretty sure December should when it came on. That was another problem that we had. So the spring one kept getting pushed back and back and back because it was just stuff that wasn't working. So the last one came out, I want to say a month ago, if I remember right. And so that newsletter is going to it did have the membership spotlights. I'm going to change the format on that because the video and the editing and stuff like that, it was just a lot for just such a small task. So I will be changing that format, but there's usually at least one CEU on there. There's resources, there's different sorry, what am I trying to say? Different articles that people write and stuff like that. The chair usually has some type of video in there, that kind of thing. But yeah, once a quarter for that. And then the email list, if you are a member, you should be on our email list already. So when we do have those, for lack of a better word, marketing, hey, we're having this, or do you want to hear about this, that kind of thing, you should be getting those. If you're not getting anything from us and you've checked your spam, reach out to us. You should be able to find us on the discussion board, or within there. You can just look for our names, and I'll put my email in here just really quick for y'all to reach out if you're not getting that, because I know there are some things that have been I can't type and talk. Hold on a second. Some people that have slipped through the cracks here and there for sure. And that's more something coming from the academy, getting the lists where they should be, right? That was a lot of work. I'm sorry. Hopefully that made sense.
Yeah, and I think the discussion board will have a lot of that information as well that you get or you can see once you sign into the website. So
but go check out the website. We worked really hard and did a big long process to get it. So hopefully it looks really pretty for y'all. And I try really hard to get those. I need to actually, when I get a chance, talk to the person that is doing the webinars so that we can get their events on the email. I mean, sorry, on the events list as well, but that's where I'll be updating those as soon as I have it. Sometimes I know a month ahead of time. Sometimes I know like 2 or 3 weeks. And then this one, we had lots of fun surprises because like everybody's sick. That's my whole email has been different people getting sick for different things. So yeah, best we can, I guess, kind of scenario, right? So,
yeah. And if anybody has any like follow-up questions or I don't know, anything, especially about like the sports or eating disorder, I also put my email in the chat. I am, like Jennifer said in the beginning, the PAL this year, but I'll be the eating disorder resource professional for the next like cycle. So yeah, yeah,
awesome.
shifting into that role.
All right. Is there anything else? Any other thoughts, questions? Also, I have had people reach out and shoot me an email just saying, hey, I would love to see this topic covered in office hours. So y'all can definitely do that if you have specific questions. Having said that, obviously we have to find the resource professional that would be most appropriate to talk about it and that they have the expertise to talk about it. So sometimes that takes a little bit of time to get together. And I will, because I know I said specifically, we've been trying to make sure we really make a concerted effort to include the IDD branch of BHN. And that is not that that's going to be a problem necessarily, but the resource professional may be a little bit less available. But there's a lot of us within the group that can help her out there as well. I'm not one of those people, but there are people that specialize in that and can help out a lot. So just, you know, you may be seeing some different answers and stuff like that, different people speaking up within that part of us. So. All right, y'all. Thank you so much for coming and being engaged. I really appreciate that. Like I said, you have my email, you have Jessica's email, and you can, if you do get on the website and there's a particular person you want to talk to, the executive committee is all listed out and you can get to our profiles within the DPG there and get in contact with us there. Okay. Awesome. Thank you guys. Thanks for coming.